Here we go.
You're tuning in to Will Love Listen. Now listen.
So I'm here with Dr. John Mesa. Thank you for joining me today.
No, thank you for inviting me.
So I'm excited to speak with you post-surgery because having gotten buccal fat removal surgery, Botox, fillers by you, and probably some more stuff, which we'll get into.
Okay.
I want to learn more about your career and your life growing up and how you sort of became an innovator doing surgeries under local anesthesia, specializing in buccal fat removal surgery, which is a very rare surgery, and, you know, everything else there is to that.
Okay, let's do it. I'm here to answer all the questions.
Perfect. So I'd like to go through your youth. I want to discuss how life was for you growing up, up until today. And I want to get into all of your success as a plastic surgeon, innovator of surgeries done under local anesthesia and buccal fat removal surgery. However, before we jump into all of that, I want to take it way back. So first, where did you grow up?
I grew up in Medellín Colombia, but part of my childhood was in Venezuela.
Okay. So how is it growing up in both Colombia and Venezuela?
It was interesting because I'm born and raised in Colombia, but then when I was 7 years old, I was brought to Venezuela because my parents got a job in Venezuela. And it was a kind of shocking experience because at that time there was a lot of kind of racism against Colombians because at that time Colombians were not a good citizens of the world because of Pablo Escobar, so we had a lot of kind of stuff that we didn't like, and I had to suffer over that. But otherwise, it was a good experience. I got to enjoy the life of Colombia and Venezuela, see the differences and similarities. I love the food. I have to say it was a tough at the beginning when my mom was trying to get me into kind of middle schools, and then we were rejected because we were Colombians and all the stuff. But finally, I made it through, and when I finished, so basically it was until 7 years old in Colombia. Then I did all my middle school in Venezuela and my high school, and then when I finished high school, I went back to Colombia to do medical school.
Wow. So you already, even at a young age, you lived a very worldly life, having, you know, lived between Colombia, Venezuela, back to Colombia. So at what age did you come to the United States?
I came to the United States when I was 23 years old. I was at the end of my medical school.
Okay, so you started school in South America and then you finished at Harvard?
Yeah, so no, I did my med school in Colombia, but I got a scholarship to study my last 3 months of medical school at Harvard. So that's because it was a big, it was a scholarship. It was a scholarship to go to Harvard. Only the 2 best students of the entire med school got chosen to go to Harvard to study.
Wow.
And that was offered me at the beginning of my medical school. I said, okay, one of those one is mine. My best friend said, oh, the other one is mine. So we ended up coming to Boston. And when I was here, I said, okay, now I want to be here. So I went back. I graduated in medical school and I came back to the United States, and I have been here since then.
That's amazing, and props to that, because Harvard is tough. Harvard is, you know, once you've gone to Harvard, you've made it. And you're a triple fellowship?
Correct.
Is that correct?
Yeah.
Wow, triple fellowship trained.
That was a lot of schooling.
Well, it paid off clearly. So let's get into that a little bit. So you're a Harvard trained triple fellowship plastic surgeon.
Correct.
I want you to get into detail about your education and certifications, because you do have a very impressive background.
Okay, so yeah, I did the math the other day. It was almost 17, 18 years of training. So yes.
2 decades worth.
Yeah.
Impressive.
Exactly. So medical school in my country is different to America. In America, you go to college and then you go to medical school.
Yeah.
In my college, in my country, after you finish high school, you go straight into med school.
Okay.
And it's 6.5 years of training. And because I was in a public school, there were some little strikes, so it was 7 years. So then after that, I came here to the United States, and you know, in America, they are not going to accept any foreigner, like, oh, come and do plastic surgery. No, even plastic surgery is very difficult for Americans.
Yeah.
So I had to do my first fellowship. I did a fellowship in plastic surgery research at Harvard. And over there, and most of the people here in America, they do a research fellowship that is about 1 year, 2 years. I ended up doing 5 years. So I paid really well my dues. I was 5 years at Harvard doing research all about plastic surgery, and then after that I went into residency. There were two ways to do plastic surgery. One to go straight into plastic surgery, and the other one was to go first into general surgery and then switching into plastic surgery. So for me, it was more feasible as a foreigner to do that. So I ended up going to do general surgery. I did 3 years of general surgery at Harvard. That was very tough because general surgery is a very tough thing.
It is.
Anyway, so after that, I decided, then it's okay, I'm ready, so I went to do plastic surgery. So after that, I went to Penn State to do my plastic surgery residency, and I thought it was going to be easier than general surgery. No way, general surgery was a breeze. Plastic surgery is tough. It's really, really, really tough. And then after 2 years of residency, I wanted to specialize. I wanted to do my best, because even though you have the basic training, if you have specialization, you get better results. So I went and I did a craniofacial fellowship. That was my second fellowship. That was at the University of Michigan. That was in 2010 to 2011. And at that time was the economical crisis. So So when I graduated, I wanted to be an academic plastic surgeon working at a university, being a professor, and of course there were no jobs. So I was like, okay, what I'm gonna do? I cannot be without a job. So I said, okay, let's kill another year doing another fellowship. So I did my third fellowship. And that was in cosmetic plastic surgery. It's about almost everything that I do right now, about facelifts and neck lifts, everything cosmetic. And I went to University of Alabama. And then after that, I was trying to get a job. I couldn't find a job. And the fellows that were coming, because the fellowships are only 1 year, the two fellows that were coming, they were foreigners and they had an issue with the visa. So they couldn't start because they were not allowed to work. And my boss told me, okay, so you don't have a job, I don't have fellows, go and stay. So I ended up doing half extra year of fellowships. So it's like a 3.5 years of fellowship. And then after that, then I found my job, and here I am, working as a private plastic surgeon here in New York, New Jersey, Miami.
Well, congratulations, because that is a lot of training, that is a lot of education. But I think it's paid off clearly, because I feel as a patient, from a patient's perspective, you want someone who's very experienced, you want someone who's very you want someone who's very experienced, you want someone who's very educated, and you want someone who knows their stuff. And clearly, you went into the business and you started knowing a lot more than your competitors and your peers. I mean, clearly.
Yeah, because I have a lot of training.
Yeah, exactly. And so now, as you get into plastic surgery, you've had a lot of success because you've made advances in facelift and neck lift surgeries performed under local anesthesia, which is very rare. I have not heard of that until you. And you've presented at national and international events held by the American Society of Plastic Surgeons. How did you perfect performing so many surgeries under local anesthesia?
Yeah, so everything started in my third fellowship. So I was training with Dr. Vasquez, a well-renowned plastic surgeon, and he was doing facelifts under local anesthesia. So I went to see the first one, and the patient was in a lot of pain. I was like, okay, the procedure is supposed to be painless, but it wasn't painless, it was very painful. So I told Dr. Vasquez, my mentor, I said, look, I train in craniofacial surgery, so I know where the nerves of the face are. I can go and do what is called nerve blocks, do injections in certain points of the face to try to make the surgery painless. And he told me, okay, if you want to improve that one, why don't you try? So I tried to do it. It got less pain, and during the surgery, I got painless surgery, but the procedure or the process of doing the nerve blocks was still painful.
Okay.
So it wasn't the way that I wanted. So I told Dr. Vasquez, I said, look, I'm happy because we can do the surgery painless, but at the beginning it's painful. I want the patients to be painless from the beginning to the end. And so we were discussing, and he told me, look, there is a guy in Canada that does hand surgery on the local anesthesia completely awake. Why don't you go to see him and see
impressive.
what? And that was revolutionary at that time. If you cut a finger, you need to go to sleep.
And what year was all of this?
2012. 2013.
Okay. So that is interesting, and not to interrupt you, because I have, and that's what this scar is over here, I had extensive hand surgery, like right on my right wrist, and back in 2019. And I hated that. I hated having to go under. I hated how I felt after all of that. So this is interesting.
So this guy was doing that for the hand. So I went and I saw some of his conferences. Sorry, I talked to him, and then I kind of grabbed his basic knowledge and I applied that into cosmetic plastic surgery of the face. So then I ended up taking away the nerve blocks, and I did my technique to the point that now patients feel no pain when I'm doing the nominal anesthesia, and then I do the entire surgery without pain. And now, even with the pandemic, now I am fortunate that I don't put anybody to sleep. I stopped going to the operating room in the hospital because now I do everything on the local anesthesia from the neck up, anything. I do it painless, completely awake.
That is so impressive.
Including the Buccal therapy.
Yeah, including what I had done. So when did you perfect this method?
During my fellowship, yeah. In the last, I would say that extra half year of the fellowship is when I perfected the technique.
So like roughly 10 years ago, like 2013-ish?
Yeah, exactly.
Okay.
Actually, yeah, 10 years ago.
Wow.
I never did the math.
So now that we're touching upon all the advances that you've made as a surgeon, performing all these procedures under local anesthesia, which I have not heard until, I came for you for the buccal fat surgery. I'd like you to speak on the risks of performing surgeries under general anesthesia versus local anesthesia. Why is it better to get these surgeries done under local?
Yeah, so any procedure, either cosmetic or non cosmetic, anesthesia or non-anesthesia, has a risks. So when you go to sleep, the anesthesiologist, even though anesthesia is very safe nowadays, there is a small risks. And I tell the patient, look, it's like a lottery. What is the chance of you winning a lottery? It's very, very small.
Yeah.
But once you win it, it's a big win. So the same is general anesthesia. There is very small risk, but if you get one of those risks, it's a problem. So when you go to sleep, what the anesthesiologists have to do, they have to give you medications through the blood. That can affect your heart rate and your blood and your body status. They have to put a breathing tube. Now that after COVID, everybody knows what is a breathing tube. They have to put a breathing tube to go to sleep. So all those things can go wrong. You can have a problem one side of the lung when the tube goes into a little bit too deep and only one lung is inflated while the other one is not. Everything. So all those little risks that potentially could be associated with general anesthesia are 100% erased with local anesthesia. Why? Because you are completely awake. You don't have to go to sleep.
Yeah.
So if you go to general anesthesia risk and you say they are very low, they could be 10%, 5%, 1%. When you are completely awake, it's zero. So that's the beauty. And I tell the patients why nowadays or people have been doing cosmetic surgery under general anesthesia. Why? Because the procedure was painful. And the patients didn't want to have pain. So who wants to have pain?
Yeah, exactly.
Nobody. But now, with local anesthesia, because you have zero pain, you can undergo the entire procedure painless. Why do you have to go to sleep? And additionally, when you recover from general anesthesia, what are the most common side effects? You have general anesthesia.
Yeah, I hated it. Nausea.
Vomiting, you feel kind of weak, like your muscles are really weak, and people say that they don't feel themselves for at least a week or 2 weeks.
Yeah, at minimum. At minimum.
You saw, when we're doing the interview, you saw a patient that did a full facelift and neck lift under local anesthesia 4 days ago.
Yeah.
You saw she was drinking her latte, walking in. She was totally fine.
It was amazing. So right before we started the interview, a patient came in. She had the full facelift like 4 days ago. And I would have thought that she had it like a month or two ago. That's how good she looked. She was up and running, talking, drinking. I was like, damn.
Yeah, exactly. And that was exactly what happened. I finished her surgery, she went to the room, she put her clothes and she walked out. So, and that's what I like about the procedure, because it increases even the risk of general anesthesia is very little, you erase it, so why not?
Yeah.
And it's faster recovery, you don't have, and nowadays when you have a small procedure, you see, now everybody's very busy. If you go to sleep, you need to have a companion. You know how difficult it is for somebody to take time off from their schedule to get surgery, and then on top of that, you need to bother a relative or a friend to accompany you.
Take care of you after the fact.
If in most of the plastic surgery procedures that don't involve the eyes, you can come, get the procedure done, and then go by yourself. You can drive, you can take an Uber, you can walk. I tell the patients to take a scooter, because you are completely awake. So that's what I like. That's what I push for doing these procedures on the local anesthesia. As I mentioned before, I'm proud that I have been almost into my second year where I haven't taken a single patient to the hospital to get surgery under general anesthesia.
That's great. That is impressive. And just to reiterate, from start to finish, there is no pain. Like once they're numbed, they don't have any nerve sensitivity, none of that.
I tell the patient, you don't feel any pain, you feel pulling, pushing, touching, but they don't feel pain. And at the beginning, they are a little bit kind of scared because they think they're in line. Yeah. But when they realize that it's not painful, we start talking about whatever is in the mood that they. For example, if the patient likes to cook, I talk to them about baking, cooking, whatever. If they like dogs, we talk about dogs and all this stuff. Because I always wanted to be an academician, try to teach people. I teach my patients and I tell them, look, I like to explain what I'm doing. And they say, yeah, good. So when I'm doing the procedure, I say, look, I'm doing this, and they get interested in the procedure and they get involved and they like it and they realize that it's an enjoyable procedure. Especially when I do the buccal fat pads, what I do to the patients when they are not really deciding if it's going to be 70% or 90%.
Yeah.
I usually say, do you want to see your fats? I give them a mirror and they look and I say, look at it, and this is what I think, this is what I'm going to remove. And they really like because they are involved in the care of themselves during surgery because they are completely awake.
And what I liked having gotten buccal fat removal surgery is that you showed so many before and afters. Mm-hmm. And I got to see how like someone looks if they had 50%, 60, 70, 80, 90, 100% removed. Now I opted for 100 because I wanted that dramatic result. But I like the fact that you have so many like before and afters that you could show patients and you really educate them on how they're going to look after the fact.
Yeah, exactly. Because my job is not just to sell surgery. My job is to make you a better person and to educate you in all the options available so you have a better informed decision about the ultimate outcome that you want with the surgery. That in this case, I'm going to be the one helping you to achieve that goal.
Now, speaking of buccal fat removal surgery, it's a very extensive surgery because it's located near all the nerves in your face that control like your smile, your muscle movement, all of that. And I went with you because you actually specialize in the surgery. I didn't want to go to a dentist. I didn't want to just go to any like general plastic surgeon. Why is it important to get buccal fat removal surgery done by someone who specializes it and not like a dentist or just a general surgeon?
Yeah, I have to say, buccal fat removal is a very difficult surgery. I make it look very easy, but technically it's a difficult surgery. Why? Because it's very difficult to find the buccal fat pad. And as I mentioned, as I explained to you during the consultation, the buccal fat pad is very close to the nerves that control the movement of the lower part of the face, especially your smile. So if you do a very traumatic surgery or you don't do a good dissection, you can go and damage those nerves. And you can have a temporary or sometimes permanent damage of the nerves, and you're going to have what is called a crooked smile. So that's why it's very, very important to go to somebody that knows how to do the surgery, because you see, the more experience you have, the less chances you're going to have of having a complication. It's like you like to do interviews.
Yeah.
Imagine you at the beginning to now. You have a lot of experience, so you can do better interviews right now. So it's the same in plastic surgery. When somebody has more experience in X procedure, the chances of having any complications minimizes, and the chances of having a better outcome increases significantly, because that's what it pays to be a specialist in a procedure.
And how long have you been doing buccal fat specific surgeries?
I went back and I did a research of my patients before and after. My first buccal fat removal was in 2014.
Okay.
Yeah. And I started to do that. At that time, it was like nobody talked about that.
No one was, yeah.
Colleagues and friends were telling me crazy, oh my God, you're going to make the patient look older and blah, blah, blah. I said, no, I believe that this is the right thing to do. And I kept doing it. And look at last year, it was the boom. And now everybody wants buccal fat removal. And the good thing is that I was not in the trend. I was riding the train of the buccal fat pads.
And it's been Hollywood's best kept secret for years now. Mm-hmm. But now everyone knows because the cat's out of the bag.
Yeah, and that's the reason why I became interested in buccal fat removal. Because when I became interested in plastic surgery because I like faces. I like to make faces more attractive, more beautiful. And I always noticed that there was a difference between people on TV or in movies in Hollywood versus street people or common people. And you know, when I trained, buccal fat removal was not in the curriculum. You don't go, oh, I have buccal fat removal class, or I have buccal fat removal surgery. No, that didn't exist. I mean, I did it in craniofacial for kids, but that was to fix holes inside the mouth. But like a part of the standard curriculum of plastic surgery, it wasn't there. So it was a very hidden, only few people knew about the procedure. So I didn't know about that, so I started to say, why people looks different? And I started to analyze. I said, look, it's the fullness of the face. It's the cheekbones and mainly the fullness of the face. And I started to see everybody in TV, in movies, in Hollywood have chisel look, and the rest of the people have chubby cheeks. So I started to do my research, and I did hear about that buccal fat removal procedure. Well, okay, I started to read, watching videos here and there, not too much explanation. Well, like, okay, let me do one. So I did my first patient. You know how long it took me to do my first patient?
How long?
2.5 hours. I was suffering. I was sweating. I was like, oh my God, what am I doing here? Because it's a very difficult surgery.
Yeah.
But then she came for the follow-up after several weeks, and she was like a Hollywood star. And I was like, this is it. This is why the people look like celebrities. And that was my motivation to continue doing. So I did another male page. The first one was a female, and then it was a male, and they look like superstars. I'm like, okay, this is what I want to do. This is what passionates me, because it's not just people say, oh, you want to be cosmetic surgeon because you want to make money. No, if I want to make a lot of money, I can be a neurosurgeon.
Yeah, exactly.
I can make
there's a lot of things you can focus on.
But I like to make people prettier, nicer. So buccal fat removal is perfect for what I want. I started to do the procedures, and I became well known about that, and that's what I love, and that's what I like to do that.
And now you're like the master of it. You're like the expert of it. You have 3 offices: Miami, Manhattan, and Livingston, New Jersey.
Correct.
So which was your first office, and what was it like to expand?
So my first office was in New Jersey, because I started to work for another plastic surgeon. The job I found that was in New Jersey. So obviously I worked for 2 years for this gentleman, and then I decided to open my own practice because I knew more the New Jersey market. I opened my office in New Jersey, but I always wanted to go to New York, because you know the best surgeons are in New York, and I wanted to be one of the best surgeons. So I said, okay, I need to open my office in New York, and that was my second office. But you know, I am from Colombia and Latino. I like Latin culture, and I always wanted to be in a more Latin environment. And when I was looking for jobs, the first place that I went to look for a job was Miami. Okay. So I couldn't find Miami. So even though I had my successful practice in New Jersey and in New York, I always had that little, what happened with Miami? So I was like, okay, so if I cannot find a job, I'll open my own job. So it's okay, I'm gonna open my own office in Miami, and that's what I did. I went, I did some research, I analyzed the market, I opened my practice, and now I go once a month to Miami, and I go operate on Saturdays, and I enjoy the Miami life Friday night and Sundays.
Oh, I love it. Yeah. I love it. And those are like the perfect locations, because they're both big tri-state meccas, and everyone's wanting surgery or at least injectables.
Yeah, and now my brain is kicking in. I think I'm going to open one in the Middle East.
Oh, really? Dubai?
Yeah.
Dubai coming soon? I could picture that for sure.
Yeah. I need to put Dubai in my name. You see, it says New Jersey. I need to put Miami there, and then Dubai.
So currently, today, 2023, what are you finding are the most popular procedures that men want and that women want, and are they the same or not?
They are kind of very similar. My number one procedure for men and women is buccal fat removal. Okay. More than 50% of my practice is buccal fat removal.
Damn, that's a lot.
Yeah, the second most common procedure that is also very popular in men and female is chin liposuction, extended chin liposuction, removing the double chin and to have a more defined jawline. The third most common procedure, which is not a surgical procedure, is a cosmetic procedure, is filler enhancement, like a facial masculinization or facial feminization, basically giving high cheekbones or more like a more pronounced chin or more defined jawline with fillers. And in my practice, the fourth most common one is now a facelift and a neck lift.
Okay.
Yeah.
Impressive. So going back, we discussed buccal fat removal surgery, and going back to the second procedure,
the
second
chin
most popular, the extended chin liposuction. What area does that cover on the face, from top to bottom?
Yeah, so the chin liposuction is to remove the double chin, but as you know, everybody nowadays wants a more defined jawline. So that's what I do. Yeah, that's what I do. Always what is called the extended chin liposuction, on which I remove the excess of fat along the jawline, always in addition of the double chin, because you know ultimately you want is to have a more snatch look, and that's what I always do in my patients, and that's why patients come to me to get the procedure done, and of course completely away under local anesthesia.
So that essentially covers the area from down here to like
all the jawline,
above and under the jaw. So like
exactly. And then in this area. And if your patient had a little bit heavy neck, also covers the entire neck.
Oh, good. Okay, impressive. And then the filler enhancement. That's basically if someone's apprehensive about surgery, so they get fillers to define.
Not necessarily. It's actually I do more fillers after surgery.
Surgery.
You see, once you remove the fat, if you don't have a good, well-defined jawbone or good cheekbones, you want to have the best results. So then, when you do fillers, it's like the icing on the cake. It gives you like the final snatch look that makes you look. It brings you from a celebrity look to a supermodel look.
Okay. Yeah. Impressive. Yeah. Impressive. I love everything. I've gotten the fillers, I've gotten the buccal fat surgery, I'm contemplating getting the extended chin, neck, and jaw.
Yeah.
So we shall see.
Okay, I'll be happy to take care of you again.
Thank you. Thank you. We'll be discussing after the interview. And as for the facelift and neck lift, how long is it? I assume that's like the longest recovery process, right?
Yeah, correct.
Out of everything. Like how long is a patient looking at?
Yeah, so when a patient is undergoing a face and a neck lift, I tell the patient you need to recover for at least 2 weeks.
Okay.
For at least 2 weeks, you're going to look like a little monster, like a Lady Gaga monster, because you're going to be swollen, bruised, but then after 2 weeks, between the second and the third week is when you're going to start looking a little bit better, less inflamed. So I tell the patients, if you are going to undergo, especially a facelift, do not plan any social events or any gathering or any public events for the next 3 to 4 weeks to make sure that everything heals correctly.
Now, lately, there's been a big stigma on plastic surgery. On social media, you have a lot of people kind of doubling down on shaming people for getting plastic surgery and all of that. What do you have to say about like this whole stigma that's going on about like, oh, you shouldn't get plastic surgery, and more importantly, the stigma of men getting plastic surgery? Because that's rarely discussed. I feel like it's more mainstream and accepted for women to get it, but with men, there's still like some like apprehension and there's a little bit of a taboo around it. Could you speak to both?
So I have to say, the way that I analyze this is from 2 standpoints. One is good plastic surgery and bad plastic surgery. Everything starts from that. And secondly is why you should do it or not do it. What is the problem with plastic surgery? There is a lot of bad plastic surgery out there. Why? Because either it could be plastic surgeons that don't do good plastic surgery, or there are plastic surgeons wannabe that try to become plastic surgeons doing procedures that they shouldn't do that give a really bad result. Every time people talk about bad plastic surgery, it's talking about a bad result. But if you analyze, yes, it's a bad result. It doesn't look natural. It doesn't look attractive. So they assume that because of that, everybody's going to look like that. But if you do really good plastic surgery, usually people don't realize that. People wonder, oh, you look better, you lose weight and all this stuff. So that's one of the best, the first thing. Second way that I see plastic surgery, should you do it or shouldn't do it?
Yes.
So I tell the patient is, if there is something that bothers you, that you think that needs to be changed, why not changing it? And it's very common, especially in facelift. Why people undergo facelift? Why? Because the body, you can do as much diet as you want, you can do as much exercise as you want, you can have 6 packs, muscular body. The face is always going to age a little bit faster.
Yeah.
Especially in relation with the mind. So people is frustrated, say, look at Dr. Mesa, that's the main complaint. I go to the gym, a healthy diet, I am 60, I feel like 40, but my face looks like 65. I want my face to match my mind.
Yeah.
And that's what you need plastic surgery, because you want to feel confident, and when people look at the mirror or when they look at the pictures on videos, they don't like the way that I do it. And I say, yes, you should do it. And plastic surgery is, if it's well done, it's going to make you feel more in harmony, more in balance of yourself. Because if there is something that bothers you, why you're not going to do it?
Exactly.
It's like, for example, somebody nowadays it's in fashion to have a straight hair, and you have curly hair. Why you're not going to iron your hair and you're going to look straight because that's the fashion? So it's the same with plastic surgery.
Yeah.
If you wake up and there is something that you don't like and you have the possibility of fixing it to make you feel better and to be better appreciated by others, why you don't do it?
Yeah,
so why
exactly.
you can get a haircut and a hair treatment and you cannot get plastic surgery? It's not the same. If you get a haircut, you can get plastic surgery.
Totally agree.
Yep.
And there should be like no stigma around it. Do what makes you feel better.
Yeah, exactly.
That's my philosophy.
But the key is to find a plastic surgeon that is going to give you a natural, good result.
Yeah, because that's where a lot of this comes from, is from bad results and people
exactly.
going to doctors that just, they'll do anything they say. So do you ever have a patient that comes in and they think they want something, but you tell them, no, you'll look better with this, or no, that's not going to look good?
Oh yeah, all the time. All the time, especially with buccal fat removal. Because you see, people come to me because I'm a very specialist in buccal fat removal, and the fact that you come for a consultation doesn't mean that you're going to get out with a buccal fat removal surgery. So, and there are some patients that come here and they want buccal fat removal, but when I analyze the face, I look at your problem is cheekbones. I say, you don't need buccal fat removal, you need cheekbones. So I explain, and sometimes I do like a trial, and then I kind of have to convince them and say, look, you don't need buccal fat removal. Look, I offered you a procedure that is less expensive, that is going to give you better results. And I show them, because I am not the plastic surgeon that is here to make money. I'm the plastic surgeon that is here to make you happy, because making you happy makes me happy. And if you don't need buccal fat removal, I'm not going to sell it to you. I'm not going to give it to you. You are going to get just the procedure that you need if it's within the reach of your goals.
That's good to know. And it's important that people go to you, or like at least a surgeon like you, because I feel like that's the reason some of these celebrities look bad, is because they'll just go to a doctor and whatever they want, the doctor will say, sure, instead of analyzing their face and saying, this will work, this won't, you know?
Yeah,
So
and that's very common with the lips. Because you see, when I do lip fillers, I tell the patients, you're going to get a little bit swollen, but then the lips go down, and then they like the result, and then the women always like a little bit more, and they come back for more, and there is a point where they want so much filler, and I say, no. I say, look at, he said, oh, I want Kylie Jenner's lips. He said,
Oh,
yeah,
God.
but to Kylie Jenner's face, her lips fit.
work, yeah.
For you, they don't work. And I say, look, if you want more filler, I'm not going to be the surgeon doing that. So go somewhere else, because I'm not going to do that horrible job.
That's good.
So I tell
That's
them no.
good. Like, I trust doctors like that. That'll say, because sometimes I wanted extreme stuff, and they're like, no. So I want to move the subject a little bit. So this interview is going to air on the podcast, but it's also going to be in magazine, Out in Jersey Magazine, which is a very large and successful gay publication.
Okay.
So could you speak on your personal life a little bit?
Oh, yeah, sure. Now that I'm out of the closet, yes. Before, hell no.
So when did you come out?
I came out when I turned 40.
Okay.
So 7 years ago.
7 years ago, okay. And how was that experience? And did you only come out to like immediate family or colleagues as well?
It was a very horrifying experience, because you know, I grew up in South America, and I was raised Catholic in a very conservative culture where being gay is the worst thing ever. It's better to hit your mom than being gay.
Oh, God.
That kind of result. And I was struggling because I always was kind of in the closet, but I wanted to kind of make everybody's happy until I read a book that is called Love Yourself, like if there is the only thing that you can do. So I realized that making people happy, my family, my friends, everybody, by me staying in the closet was like being in jail or being a slave of myself, because I was making everybody happy, but I'm very, very unhappy. And then I turned 40. That was the reason. I turned 40. I was like, okay, I'm 40. I'm not married. I don't have kids. What I'm gonna do with my life? I was about to get married a couple of years before, but I broke the engagement, and I met a couple of friends that they were married with kids in the closet, and then they came out.
Okay.
And that experience for me was very, very traumatic. Why? Because I think when you're decided to be a father, you need to give the best to your kids.
Yeah, I agree.
You can be a good father if you're straight or you are gay. But for me, being a father that is straight and then suddenly comes gay, I think it's very traumatic for the kids. And I say, I don't want that for my kids. So I was debating. So I met this couple of people and I say, no, I don't want that to do that. Because you see, whoever would be my wife would be destroyed. And then my kids are going to say, okay, my father that was straight is now gay. So I was like, no, I don't want to do that. So I did a lot of introspective. I said, okay, I'm going to come out. I said, it's done. Whoever likes it, yes. If they don't like it, if my family hates me and doesn't want to talk to me, I say, okay, it is what it is because I cannot continue suffering, making them happy. So I came out with some friends and then I tried to come out only to my friends and keep it secret at work.
Okay.
Why? Because I have a lot of Latino patients. So, and I thought that if my patient knew that I was gay, that my practice was going to be destroyed, that I was going to lose the patient. So I was terrified about that.
Of course.
And I accidentally came out to my nurse in a text message that I meant to send to somebody else's. And I was like, okay, good. So I had to come out at work, and then I realized nothing was bad. It was like a thing. Oh, you're gay? Yes, sure. There is a patient in the next room. I was like, okay. So that work was okay. I started to come out to my close friends, and then there was a Christmas that I had to go to Colombia, and I said, okay, this is where I'm gonna tell my family I'm out of the closet. I was petrified again because I thought my family was going to kill me, and I have one uncle that I thought he was very macho, very kind of old-fashioned, that he was going to get a machete and chop me in small pieces. And I went to a Christmas party and I said, hey, and in the closet, this is my boyfriend. I brought my boyfriend, I'm still with him now. Everybody was like, oh, sure, oh, cool. It was like oh, look, I bake a cake.
Yeah.
Nothing out of the blue. And then this uncle that I thought I was so horrified about him, he was like, how did you meet? How long had you been together? He was super interested about the story rather than telling me, oh, you're a bad guy, you're going to burn in hell and all this stuff. And I'm like, oh my God, I suffered all these 40 years, 35 since you are a kid, thinking that my family was going to kill me, and they didn't kill me. So I was like, okay, so that was easier than
expected,
but the problem is that you have all those expectations that you build up all your life, that they are all created in your mind, that makes your life miserable and makes you not to come out. If I have to say to anybody that is in the closet, you should come out before, oh yeah, big time. Because it's like being released. It's like you feel yourself and you don't have, then you become more mature and you say, look, you're going to be happy. You try to make your family happy, and who doesn't like it, okay, next. Because you cannot make everybody happy as long as you are happy. So
such an interesting story, because it's like you built yourself up that it's going to be like some big bad experience, and then it's nothing, and then you're like, oh.
Yeah, and the other thing is that I have been living in America 23 years, so even though I was in America, in New York, far away from my family, I was still deep in the closet.
That's so interesting.
Because I was horrified.
Scared of,
I thought like, oh, somebody's going to see me, they're going to call and tell my family, blah, blah, blah. So, but I'm glad that I'm out. I'm happy.
I'm glad too. So are you on the market or no?
Oh, no. I came out of the closet in my birthday. That was when I decided. My birthday is in February. And
when in February?
February 8th.
February 8th. Okay, so you're an Aquarius?
And an Aquarius, yes, an Aquarius. And I was like, okay, I'm very late in the game. I did a little bit of dating here, but I said I wanted a boyfriend. So July 12th, July 12th, I found my boyfriend, and I have been with Alexis since then. So we have been 7 years together.
Oh, that's amazing. Congratulations.
Yeah. So I'm not in the market.
Wow, congratulations.
And I will never be in the market because Alexis is going to be my partner for life.
Oh, I love that.
Yeah.
I love that. That's such a good story.
Yeah.
Yeah, you've lived an interesting life.
Kind of.
Colombia, Venezuela, United States.
No.
A lot of education, multiple practices, innovating plastic surgery. You're happy, you're out.
No.
Such an interesting story.
Yeah.
thank you for taking the time to sit down with me today, answer all my questions, and educate everyone on what you do as a surgeon, what you specialize in, and what they could expect if they come to you for any procedure.
Yeah, no, actually, I have to thank you for letting me be your surgeon, because for me, it's an honor and a privilege that somebody's going to trust his or her face to my hands. Because that's the other thing that I like about plastic surgery that I perform. Anywhere from the neck down, if anything goes wrong, you can hide it with clothes.
Yeah.
In the face, you cannot hide it. So you need to have you need to be really confident that you can deliver that. And for me, every time a patient says, yes, I want you to be my surgeon, it's an honor and a privilege, because you see, as you can make somebody beautiful or more beautiful, you can ruin somebody's faces. So for me, that's a big honor. And secondly, thank you for inviting me to do this interview, because I think anybody's stories could be useful for anybody that it could be in the same boat or want to become a plastic surgeon or anything. And this is an outlet that I wouldn't have the possibility to be in if you didn't invite me to this interview.
Oh, thank you. I really appreciate that. I really appreciate that. It makes me feel good.
Okay, thank you so much.
Thank you. And next, we'll be discussing a possible new procedure and taking after photos, but off camera. And you'll see that later.
Okay, excellent.